The person needed a primary care doctor was the first thing that person said. That's something we can address. We do that a lot. Then the person said, I haven't had anything but a piece of toast in 3 days. Part of what we have the time to do is listen.
Having someone, even one person, is significant. And that support being someone who believes in you and someone who isn't judging you and is supporting you and standing by you.
I'm not very good at time limits, so we might be there for an hour when you expected 10 minutes.
I want to be actively listening to that person. That's how I wanted to be heard over the years when I've had some difficult situations.
I brought her in. It was a walk-in, and you don't know when you do a walk-in, are you going to get 10 minutes, 5 minutes? She was quickly telling me what she needed to tell me, and I said, tell me more about how that's working in the home. And you could see her sit back and tear up, and she hadn't been asked that.
There's always more underneath that we don't know about. There's more to you than just what I see.
It's just a real privilege to be able to hear people's stories.
To love our community, to love the people I'm surrounded by, to love the people coming through the door, to love the people's door, the people whose doors I'm going through. That opens up the ability to not be judgmental and to be open and to be supportive. Yeah.
I didn't know that this would be like life-changing experiences every time something happened. It feels good to be able to help people and see that full circle.
Here's somebody that's in the community that's part of our system, so they can meet with you while you're here. I can provide education on what we're able to provide and do that warm handoff. So then we're pulling you in before the patient even leaves, and we know they're going to have that support in the community.
I think we're very helpful in helping clarify what the client has said, or perhaps add another dimension to it that the client might not have even identified with the provider.
Doctors give 15 minutes. They've got a lot to do in 15 minutes, and they've got to document it all. What I can do is sit down with you and say, tell me how you're taking your medications. And you might share with me that you're not. We can sit down with someone and have that conversation.
I love the framework. I love the system of care that we're able to provide.
And I think it feels good here.
We also teach team-based care. We've taught over almost 200 of our partners the patient engagement tools and how to connect someone to a team that is helping them work on their goals.
The role as a community health worker here is to be available for individuals to come and seek resources.
The domains include healthcare,
Mental health,
Housing, transportation,
recovery,
medical supports, prescription access,
diabetes support,
insurance access, education support,
financial coaching.
We have 2 health coaches. Right now they're working with one of our practices and providing a pilot project for diabetes. So working with our nutritionists and the health coach, they partner with the person with diabetes to learn how to take the best care of themselves.
I do think there is a culture of the Northeast Kingdom that may make us think that we need to be more independent, or family helps family, and that may keep us from taking services that we could have. And so I think that sometimes that's been a barrier for people.
I think some people feel like they are vulnerable if they're reaching out for services. That makes them look like they can't handle it on their own.
And I think the rewarding part is seeing people self-manage. I don't want people relying on me. I want them to have a conversation with me and then be able to do it themselves, or at least know where to come to get the resource to support them to do it themselves.
You're the one doing the hard work, and I'm just helping you access those tools.
It's so valuable for us to be able to have a patient coming in with no insurance and all this anxiety about how are they going to afford their new medications.
Someone's wellness isn't just one thing. It's not just a doctor's visit. It's not just mental health. It's a whole. As a community health worker, I have an opportunity to help address all those pieces.